Now I want to talk about the immune system. Dr. Masihi used to teach for immunology. We both had years of microbiology, biochemistry, and virology studies. We've made it our life's work to understand this stuff. And here, I'd like to go over some basic things about how the immune system functions, so people have a good understanding. The immune system is built by exposure to antigens, viruses, bacteria. When you're a little child crawling on the ground, putting stuff in your mouth, viruses and bacteria come in, you form an antigen-antibody complex, you form IgG, IgM. This is how your immune system is built. You don't take a small child, put them in bubble wrap in a room and say, go have a healthy immune system. This is immunology, microbiology 101. This is not something, this is the basis of what we've known for years. So what I'm seeing is when you take human beings and you say, go into your house, clean all your counters, Lysol them down, you're going to kill 99% of viruses and bacteria, wear a mask, don't go outside. What does that do to our immune system? Our immune system is used to touching. We share bacteria, staphylococcal, streptococcal bacteria, viruses. We develop an immune response daily to this stuff. When you take that away from me, my immune system drops. As I shelter in place, my immune system drops. You keep me there for months, it drops more. And now I'm at home, hand washing vigorously, washing the counters, worried about things that are indeed what I need to survive. Let's follow the science. This is immunology, folks. This is microbiology. This is what we've combined together. We have 40 years of experience in this. This is common sense immunology.
So quarantining and social distancing is worse for us, you're saying?
It decreases your immune system. You can't build an immune system by... If someone has a reduced immune system, you hide them away because they can't build an immune system. If you have a normal functioning immune system, you need interaction. When a child's in a womb, you're in this protected environment. When you come out, you have almost no immune system. You develop that through touching your mouth, touching your eyes, virus, bacteria, immune response, IgG, IgM. This is how you build a strong immune system.
You think people are worrying too much?
Of course they are, but that's from media telling them to. I am telling them sheltering in place decreases your immune system. And then as we all come out of shelter in place with a lower immune system and start trading viruses and bacteria, what do you think is going to happen? Disease is going to spike. And then you've got disease spike amongst a hospital system with furloughed doctors and nurses. This is not the combination we want to set up for a healthy society. It doesn't make any sense.
So is Dr. Fauci wrong then when he says that COVID-19 is shown to be nearly 10 times deadlier than the flu?
Initially, maybe that was true. But again, I'm going through the numbers. I'm not saying who's wrong or right. I'm going through the science and through the numbers. And I, like you, have been watching media and studying this for 2 months, night and day. I go to bed at 2 or 3 in the morning. Every day I read after my shift and I say, what's going on here? I'm not in an ivory tower. I'm in seeing patients every day and I'm collecting my own data. I didn't have data 2 months ago. I just shared my data. 6.5% of all patients we tested are positive. That's actual, unfiltered, non-political data. The initial models were so inaccurate, they're not even...
But in those initial models, a lot of them were based off if we did no social distancing.
Right.
Correct? So is it really fair to say, obviously they're not as bad as they were because those were based on alternative scenarios?
And some of them were based on social distancing and still predicted hundreds of thousands of deaths, which has been inaccurate. Then when you bring up a system of lockdown, you automatically have to compare it to a system of no lockdown. Sweden and Norway. I'm Norwegian.
Norway has lockdown.
Norway has lockdown. Sweden does not have lockdown. What happened in those two countries? Are they vastly different? Did Sweden have a massive outbreak of cases? Did Norway have nothing? Let's look at the numbers. Sweden has 15,322 cases of COVID. They did 74,600 tests, which is 21%, similar to the other countries. 21% of all those tested came up positive for COVID. What's the population of Sweden? About 10.4 million. So if we extrapolate out the data, about 2 million cases of COVID in Sweden. They did a little bit of social distancing. They would wear masks and separate. They went to schools, stores were open. They were almost about their normal daily life with a little bit of social distancing. They had how many deaths? 1,765. California's had 1,220 with isolation. No isolation, 1,765. We have more people. What I'm getting at is millions of cases, very small death. Millions of cases, very small death. This is what we're seeing everywhere. Norway, its next door neighbor. This is where I come from. These are two Scandinavian nations. We can compare them as they are similar. Let's look at the data. Norway, 7,191 cases of COVID. Total COVID tests, 145,279. So they came up with 4.9% of all COVID tests were positive in Norway. Population of Norway, 5.4 million. So if we extrapolate the data as we've been doing, which is the best we can do at this point, they have about 1.3 million cases. Now their deaths as a total number were 182, fairly small, but statistically insignificant from 1,700, you realize. Millions of cases, small amount of deaths. 1,700, 100, these are statistically insignificant.
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do. Some physicians really have a bent towards public health, and they will put down influenza or whatever because that's their preference. I try to stay very specific, very precise. If I know I've got pneumonia, that's what's going on the death certificate. I'm not going to add stuff just because it's convenient.
There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that.
If someone dies with COVID-19, we are counting that.
Anyone who has COVID when they pass away will be included in that category. Dr. Ngozi Ezike explained this does not mean the virus caused that death, but if someone does test positive for COVID before dying, that is classified a coronavirus fatality.
You were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. Everyone who's listed as a COVID death doesn't mean that that was the cause of the death.
Doesn't mean that that was the cause of the death.
I'm up on stage.
60,000 deaths.
And all the rage I feel inside of me.